Hello dear friends and colleagues, I'm Stanislav Chernog, the author and creator of the online school Vector Massage and Somatics, and today we have the video that appeared as a result of observing your interests. I found that facial videos are of great interest to you, so I decided to make a separate video that would show you what a face is like, how it works from the point of view of a massage therapist. In fact, there is a big eternal discussion between masseurs and cosmetologists. Cosmetologists say that you can't deal with the face because the face is such a special place. It requires completely different fingers than a massage therapist's, and in general do not meddle in our face. We masseurs believe that the face is exactly the same part of the body as all the other parts of the body. Moreover, it is impossible to understand what is happening to the face without understanding what is happening in the entire human body, and our whole body affects the state of the face. Therefore, I am making this video as an overview of what is happening in the face, the main problems, the main manifestations. The complexity of working with the face lies in the fact that the face does a lot of things at once. We must remember that the face is the place where emotions exist. This is the most emotional part of the body, and if we have problems with emotions, then this will manifest itself in a change in the shape of the face. For example, if a person is stern all the time, then a wrinkle will form between eyebrows. This will be manifested in the specific mentality of a person, and this will manifest itself in the excessive tone of the muscles that wrinkle our eyebrows. Accordingly, the work of a massage therapist to correct this place will consist on the one hand in relaxing the muscle, and on the other hand that the person with whom we work has noticed that the one is stern and permanently wrinkles the eyebrows, and give the appropriate exercise. Or for example, if a person is sad or everything makes the one feel disgusted, a person has a special expression for expressing the emotion of disgust. It lowers the corner of our lips. Accordingly, the puppet jaw is such a specific story when the corner of the lip is lowered, and accordingly we can help our patient correct this emotion through work with the muscle, through work with the corresponding crease on the skin. There are special techniques, and most importantly, through the realization what occurs with the corner of the lower lip in humans. How to work with the puppet jaw? First, we must find the muscle that actually makes this deformation in the face. This is the muscle that runs from the outer corner of the mouth to the lower jaw. If we find the places of attachment of this muscle and push through this muscle, then after a while it will relax. But the most important thing that we need to do is to show the person that the face takes on the expression in accordance with which the person lives. If a person is disgusted by everything, then the face will correspond to the face of a person who is disgusted by everything. Here we will not get any clear results until we change in fact the style of perceiving life. What can be said here? In addition to the fact that a person will get a beautiful face, one will also change life for the better. Here, for example, right now you can look at your screen. One person obviously lived a happy life, or at least happy now, and the second obviously lived some kind of a difficult life, which resulted in the fact that he is not living very well right now, and you can see it in their faces. And the second direction that deforms the face is the direction associated with the general posture of a person. It must be remembered that the face is the final part of the whole body. In a sense, everything that happens in our body affects our face, how it may look. For example, if a person has problems with breathing, diaphragm, prolapse of the pelvic floor, arch of the foot, everything related to the deep frontal line, this will lead to the fact that the muscles of the neck in front will be excessively tense. Accordingly, a person will have a sinewy neck. Or the second problem, when a person, for example, has a posture when the head is moved forward, and this will form specific folds in the neck, which are called rings of Venus. Another problem is if a person has weakness in the muscles of the posterior surface of the back, and the muscles of the posterior back are attached paradoxically to the eyebrows, then the person's face will strive to somehow support the line so that the head does not fall forward and will wrinkle forehead. Here I have such a problem. I have a weak back. Since my childhood, I'm specifically working on this, and now every time my head moves forward, I start to wrinkle my forehead, and when I keep my posture straight, the wrinkles on my forehead stretch so that my forehead does not need to support my back. To simplify it further, when the head leans forward, when the back muscles do not hold the head, then my eyes look at the floor, and my eyebrows block my forward vision. So I have to raise my eyebrows to look at you, my dear viewers. All these problems are united by the simple fact that nothing can be done about these problems unless you deal with the body. No, of course you can put Botox into the frontal muscles and your eyebrows will constantly hang, which will lead to the fact that you have to throw your head back. This will lead you to headaches, but you can solve the problem with Botox. I repeat once again that the problems of the neck, the problems of the forehead, are in the posture of a person. The next significant problem will be the problems of inflammatory processes somewhere in the head. For example, there is a problem of maxillary sinuses and in general rhinitis, which can exist in humans. For some reason, a chronic infection lives in a person's nose in the nasopharynx. This leads to the fact that there is a continuous inflammatory process. This leads to the fact that lymph stagnates here. This forms a specific fold. Here, the nasolabial is to a very significant extent connected with the processes that occur inside the nasopharynx. Similar problems we can observe in connection with the teeth. For example, if there are problems with the gums, then again the outflow of lymph will be difficult, and this will lead to the fact that such folds on the cheeks will form here. The same can be said about the lymph nodes behind the ears. In some people, especially the elderly, specific folds hang on the side of their jaw, and these folds are associated with inflammatory processes in the nasopharynx and in the teeth and jaw. All the described problems associated with inflammatory processes and all inflammatory processes are associated with impaired circulation of the lymph. Relatively speaking, our face is the place that leads in the number of sphincters per unit area. We have the orbicular muscle of the mouth. We have the orbicular muscle of the eyes. We have muscles that squeeze our nostrils and spread them open. In addition, there are muscles that increase or decrease the ear canal. All these muscles are actively involved in shaping the face as it is. For example, if for some reason a person has a tendency to keep lips compressed, it may be psycho-emotional reasons, it may be causes of inflammation in the intestines, this may be a habitual state of facial expression. In any case, the orbicular muscle of the face will deform the entire face around it. For example, if the orbicular muscle of the mouth is tense, this will cause the lips to be dry and wrinkled. On the other hand, if the orbicular muscle of the face has insufficient tone, then this will lead to the fact that the muscles that stretch the oral fissure, these muscles are that raise the upper lip, these are the muscles that lower the lower lip, and the muscles that stretch the corners of the mouth, all these muscles with the insufficient tone of the orbicular muscle of the mouth will also have insufficient tone, and accordingly the whole face will sag and look much less presentable. The same can be said about the orbicular muscle of the eye, which forms the following problems such as hernia of the lower eyelid, a dropping eyelid, or for example crow's feet. All these are problems associated precisely with the fact that the orbicular muscle of the face is a sphincter. If for some reason we have an excessive or insufficient tone of these sphincters, this will lead to the fact that they will deform the muscles around them. What can be done about it? First, you can do manual work. If, for example, we talk about the orbicular muscle of the eye, then it is attached to the inner surface of the eye, approximately at the transition between the upper part of the eye socket and the nose. This is where the muscles are attached, and at the moment when we act on this point, it can be painful. Besides helping to improve the condition of your vision, in addition to these, it also tones the orbicular muscle of the eye. This in turn will lead to the fact that swelling in the upper eyelid will decrease, swelling in the lower eyelid will decrease, tearing of the eyes will improve, the eye will begin to shine better. In addition, the crow's feet may disappear along the outer surface of the eye. In general, I would like to say the following about the crow's feet. If a person constantly keeps the orbicular muscle of the eye tense, then this will lead to the fact that the skin on the outer surface of the eye will be wrinkled all the time. This will form specific creases called crow's feet. Here we must understand that it is necessary to simultaneously combine several areas of work. This is manual work. Secondly, there are specific gymnastic exercises for the muscles of the face. Thirdly, it is work with the state of consciousness, how suspicious I am, and how I crinkle my eyes, or how much I look at the world with wide eyes and my face is relaxed and calm. And of course, we remember that there is a problem of reflex zones on the skin of the face, which is entirely associated with the internal organs. And if we have skin rashes, then these are problems of the internal organs. And the last topic that I would like to touch is age-related changes in the face. The fact is that we should remember that the face is continuously in the field of gravity. That is, gravity pulls the face all the time, and for example, such parts of the face as nose, which especially protrude beyond the face, or for example the ears, grow throughout life. There is a separate gymnastics and massage practices that allow you to solve this problem through manual work and appropriate gymnastics. And I, Stanislav Chernog, say goodbye to you. I am the author and creator of the online school of vector massage and somatics and the YouTube channel of the same name. The channel where we talk about humans, the channel where we look at us in a complex way, and the channel that helps you earn more money. See you again, friends. Goodbye.